Good morning, everybody. We're happy to have you here. My name is Sandra Rivas. I'm a director of senior programs for Openhouse plus Unlock Community Day Services, is a LGBTQ plus affirming adult day program. And I'm going to go ahead and let our panelists introduce themselves. This is a great group of people, but just to frame this discussion, during this session, we will learn about the status of policy discussions surrounding Social Security disability insurance, Medicaid, and other critical programs, and the impacts to individuals and organizations serving impacted populations. We will have some time from Q&A at the end, and I'll go ahead and pass it to Vince to introduce himself.
Hi, good morning, everyone. My name is Vince Cristostomo. My pronouns are he, him. I'm a 64-year-old queer Chamorro male. I've been living with HIV since 1986. And currently, I'm Director of Aging Services at the San Francisco AIDS Foundation. And I also sit on a number of policy bodies that look at aging and HIV and the different intersectionalities.
Hi, everyone. My name is Jessica Ang. I'm a physician and the medical director at Unlock PACE, which is a healthcare and long-term care services, including medical, transportation, support services in 3 Bay Area counties. And I'm the medical director there and oversee the care there for our mostly Medicaid population. And I'm also an associate professor at UCSF, cancer survivor, and an advocate for low-income older adults.
Good morning. My name is Paul Aguilar. I'm the long-term survivor community liaison at the San Francisco AIDS Foundation in their Aging Services Department. I'm also a long-time advocate and activist affiliated with the HIV Advocacy Network, former chair of the Harvey Milk Club, HIV Caucus, and fourth-generation native San Franciscan who's been living with HIV since 1988.
Hi, everyone. Good morning. I am Miss Billie Cooper. Never Billie Cooper, always Miss Billie Cooper. And I am a 66-year-old unapologetically black transgendered woman. I'm a long-term survivor. I was diagnosed May the 15th, 1985. So my HIV is probably older than most of you in the room. Well, all of our HIV probably. But I'm happy to be here. I'm a community advocate and activist for over 4 decades, and we were there in the beginning, before this had a name, before it was GRID or even the Gay Men's Plague. We were there. At least I know I was there. We were there. So, you know, I'm happy to be alive and to be kicking and to be able to talk about my experiences living with HIV and the Medi-Cal, Medicare, Medicaid thing, you know, so.
Thank you. I'll start with Jessica. Can you speak to some of the potential changes to Medicaid and how that might impact Medicaid programs such as PACE? What are you paying attention to regarding the possible policy changes and the impact to seniors we serve?
Oh, where do I start? Well, I just want to do a few definitions first, just, you know, for those of you, so Medicare, federally funded healthcare for health insurance for people over 65. Medicaid, federally and state funded healthcare for people of all ages with low income. So those are, I want to make sure that those are 2 separate things, and we're going to mostly talk about Medicaid here. So I want to say that we don't know yet exactly what's going to be signed into law, but that there are proposed cuts at both the federal and state level that will disproportionately impact older adults. Medicaid is really the backbone of our country's healthcare system, particularly for people with low income. And I think we at Unlock, I think everyone here is pretty concerned about how, you know, these proposals, if they go through, how they're going to affect vulnerable communities. We think that any cuts to Medicaid will hurt LGBTQ older adults and prevent them from accessing their health care, particularly prevention, chronic disease management. Medicare alone. So if most of the cuts are going for Medicaid, so Medicare alone isn't really adequate to meet the needs of particularly vulnerable LGBTQ older adult populations. So Medicaid funds is the primary funder of many community-based programs that LGBTQ older adults access and help them live independently and keep them from being institutionalized in long-term care, like in nursing homes, and allows them to stay within their communities. So there is a budget on to be signed on Governor Newsom's desk right now. Some of the things that they're talking about and are in there are reinstating the Medi-Cal asset limit to 2024 levels as part of eligibility, so whether or not you can get Medicaid. And they're also talking about starting to charge people more like monthly premiums, for people between ages 19 and 59, if they have a certain immigration status. We're talking undocumented or haven't been in the country for a certain amount of years. So that's sort of like what they're talking about at the state level, really kind of starting to limit who will be eligible for Medicaid. And then at the federal level, there's a House bill that has passed that cuts over $800 billion for Medicaid and adds work requirements and also making people keep, checking their eligibility, having a redetermination, these checks and balances to see, to make sure that you're still eligible and potentially kick people out of the program, making that more frequent and reducing their part of funding that goes to the states to run their Medicaid programs. So the Senate is negotiating their own bill, which looks potentially worse than the House bill for Medicaid funding. When the Congressional Budget Office looked at the House bill, overall, that low-income households will have at least $1,600 in fewer benefits per year, and high-income households get $12,000 more per year in that budget. So I would say that, on LOC, we serve 99% people with Medicaid, and I'm thinking about what is it that I'm most worried about? I mean, I've been talking to the participants in our program, some of them sobbing, just fearful for the last 6 months about what's going to happen to the services that they rely on to stay in their communities. But one of the things I'm just really worried about is, that Medicaid programs like UNLOCs, we provide not just medical care, because we all know that my prescription pad doesn't fix everything, in terms of people's health, that we provide nutritious food, we provide transportation to visits, things to lower the barrier so people can get the preventative care, the chronic care for diseases like HIV, diabetes, to prevent, emergencies, hospitalizations. And I think without that preventative care, more people will be delaying their care, going to the hospital. We've seen this a number of times, but during COVID, when people didn't have access to their preventative care, the hospitals got full. And then you're like, okay, then that doesn't affect me because, I'm planning on staying healthy. But, I think that when the hospitals get full, they start canceling surgeries that they say can be delayed. So this happened to, patients and colleagues of mine where you get diagnosed with cancer. You're like, okay, first step is you need to have surgery. You're like, oh, but there are no beds in the hospital, so that surgery is going to be a few more weeks. Or if you need a heart, they decide that it's elective, it's not an emergency, but you're like, when you have a heart problem, you kind of want to have that surgery as soon as possible. And so I'm really worried about this whole network of both medical care and support services that will push all the care to more to the hospitals who are poorly equipped to take care of what people's actual needs are.
Thank you, Jessica. Vince, the San Francisco AIDS Foundation has been engaged in advocacy around HIV and health policy. Can you share what policy changes you have been tracking, the impact on the communities you serve, and your personal passion for this work?
I might not necessarily answer that question, but, we we talk about our community as vulnerable populations, but honestly, these changes, everyone is vulnerable. And often when these benefits are referred to as entitlements, they're not entitlements. We have been paying into this for the majority of our lives at some point. And so I really think that there needs to be education around how the health systems in this country work. Under Social Security, one of the things for being a long-term survivor, it's often said that we didn't plan to live, we didn't save, we didn't do all these things. A lot of people assumed that Social Security, whatever our benefits, would take care of us. And now we're finding that that's not true. I also think that at some point our community became very complacent because, we overcame, we rose above, but then now it's being rolled back. And I don't think that we're entirely prepared for the massive amount of destruction, because even if we were to get the current administration out of the office in the next couple of weeks, it would still be a huge challenge for us to kind of recover from where we are now, because that's how quickly the damage has been done. For Social Security specifically, we have seen, and I'm going to use HIV as the example because that's what I'm most familiar with, but the direction on HIV as a disability is very different from having an AIDS diagnosis. And having a clear disability is very different from having something where people can question. So a lot of times when our folks have presented for disability, because it's not clear, they've had to wait a year or year and a half to get their benefits. They often have to have a hearing. You also need to have a lawyer or someone who knows the health system. We made great strides last year. We almost got HIV and being LGBTQ into the LGBTQI plus into the Older Americans with Disabilities. Older Americans Act and Older and Americans with Disabilities, that was tanked. And so what that means to our community was we're yet to be seen. We're lucky in California that we do have the HIV and Aging Act, which was passed in 2021, SB 258, and it lists LGBTQ folks and HIV has a population of significant social need. One of the things I've had some success with is referring some of our participants in our 50 Plus network to go for survivor benefits. Many of us lost our partners in the early days of the pandemic, and you haven't remarried. You actually, it's probably not going to happen right now, but you actually qualified for survivor benefits. I think we got at least one person. It took almost 4 years, but I got a note from them on November 1st, 2024 that Social Security recognized his relationship with his partner who had died in the 90s. And they didn't do a lot to educate people around that. And this is where knowing your rights. And, it's really challenging because not everybody, because HIV is only like 44 years into history, it's kind of like middle age. And we are really going through a midlife crisis because nobody expected this. And, but it's important. Often, this might sound kind of weird, I don't know, but it's often said that the current generation stand on the shoulders of their elders. They do, but I kind of think we need to change that, and we need to stand side by side, because when you link arms, it's very mature, but when you're standing on the shoulders of someone, it's very easy to topple over. And so that's just kind of a somatic thing, but I want people to think about that because I think it takes all of us reaching across the aisles. And, there's so much politics that are happening right now, and I think we need to be nicer to our politicians that are the front line because they are a barrier. I mean, we may have disagreements with them, but where's the greater disagreement? With those who are advocating for us, or at least being openly LGBTQI in their positions of policy, or those on the other side who are wanting to take everything away. I really do think it's a time where we need to figure out what it is we want to accomplish, who we are as a community, and it's really important that we lift up our trans folks. It's like people, I don't know how to say this in a way without insulting my current generation, but like what has happened in the last 10 years is the stuff that we fought for in the 80s and 90s, and they are taking advantage of that. Like when I was in my 20s, nobody encouraged me to be my full, beautiful, big self. It was a 20-something-year-old in 2019 who told me, just be yourself. That's all we ask. And I do think that this is something because we need to protect. And, we're gathering for Pride, and, there's a lot of criticism about SF Pride and how commercial it's been. But the thing is that, for someone who doesn't have that, I was a Grand Marshal in 2019. Paul was a Grand Marshal in 2023. You do not know what this parade means to people, the symbolism, the hope, the faith that comes with seeing people marching out and being in public and being like, I remember going through the streets and just looking out and seeing people hugging their kids waving at us. And I think for my generation, we know what there is to lose, and we need to show up as well as with young people, because we fought for this. And yes, they can try to erase us, they can erase websites, they can take books off of shelves. There's all these things they can do, but we still have to stand. They can't take away our lived experience, they can't take away our knowledge, they can't take away our truth. And that's where we really need to come together as a community and learn from our past, but really look toward the future. When I was in my 20s, nobody asked me where I wanted to be because they didn't think I was going to live. But where do we want to be in 4 years when this administration will hopefully be done? And how do we stick together to get there?
Thank you, Vince.
Did I answer the question? I probably didn't.
You did.
Okay.
You definitely did, and some. Miss Billie and Paul, can each of you share how these policy changes might impact or have impacted you personally in the greater community?
Thank you so much. Thank you. Good morning again. I would like to say, I come from a little different perspective. I was there before Medicare and Medi-Cal stepped in to basically across the United States really help Black and brown people. I remember a time before HIV, how people were struggling, how people were medically wasn't getting the help medically, innovative care at the hospitals and the clinics. I remember when we were going through diabetes and high blood pressure and all that, and Black people and brown people were dying. And I remember growing up in Philadelphia, being a kid over 50 years ago, over 60 years ago, we didn't really worry about it in inner city Philadelphia in what was called the ghetto, because we always had one clinic in the neighborhood that would help us no matter what. And thank God my father worked for the city of Philadelphia, and he had good benefits, so I don't think I really had too much to worry about. But moving forward to HIV, and with all these cuts with Medi-Cal and Medicare and Medicaid, each and every time I see a letter from Social Security or the VA, my anxiety and my stress level, goes up. Just thinking about getting something from the VA or Medi-Cal, Medicare, saying I possibly owe them money or my care is going to be cut. They take money each and every month. They take over $170 from me for Social Security, for Medicare, Medi-Cal. And if they take it away, I'm screwed. I'm really screwed. But I got the VA in my back pocket, and I thank God for the VA. And I thank God for Openhouse. Openhouse has come in at a time years ago and provide services for people we didn't see back in the 70s and 80s, and we didn't see. I remember Tenderloin AIDS Resource Center when I was there. I remember Hospitality House. I remember what's the name of that place that helps people with the money? Episcopal Services. Yes, AIDS, yes, the AIDS Relief Fund, yes. I remember all that. And I remember a time in the Tenderloin when this worked, when we had one big drop-in center where people would come and there would be a little fisticuffs every once in a while, but it wasn't nothing to call the police because they had their own security. But I remember those days. I remember sitting in the doorway of the Tenderloin AIDS Resource Center holding my sisters and brothers who were dying of AIDS, because we don't hear about all the people who just bypassed HIV diagnosis, who went straight to AIDS and died. We don't hear about all the people that didn't get an opportunity to get the medicine. As I sit here, I'm a AZT baby. I took AZT for over 6 months. And, you know, they really started giving that drug to people who had lesions and people that were diagnosed with AIDS. But I know I had a couple AIDS diagnoses back in the early days. But yeah, I used to live at 7th on 8th and Natoma, Cannon Kip. Yes, 715 Natoma. Yes, I lived there. And speaking about HIV, things are like Vince said, are peeling back. We're going right back to the early days. And, you know, it's a shame that black and brown people always have to get added into something. We can never be in the beginning with everybody else, you know, with the research and with the medicines. And I just hope and pray that all my brothers and sisters who are on Medi-Cal, Medicaid, Medicare, get it updated and make sure they have their benefits, you know, and get you a new card, get that new plastic card so you can get your benefits. And dental, it just my anxiety, like I said before, my anxiety about from 7980 to 2025. I really have high anxiety, you know, but I have hope. I have hope too. I have hope, and I'm inspired that things are gonna, you know, somehow get back to where we need to be and where everybody is on equal ground, like Vince said. And I like that, Vince, standing side by side, because my shoulders are tired, you know. So thank you all for coming out this morning. Yes. Yeah. And thank you.
Thank you, Miss Billie. They're big shoulders, too. Those are big shoulders. You also...
Did he say I have football?
I did not say that. They're strong. That's why we lean on them. So you looked at me about them owing money? Mm-hmm. Yeah, they tell me I owe them $200,000 now. And that's frightening. The impact of these cuts are real lives. These are real lives that this is impacting. There's so much I could talk about, and I only got 10 minutes. I was in a meeting yesterday with NMAC, National Minority AIDS Council, talking about these cuts to Ryan White that they're proposing, and one of them is Part F, which is the dental, and all of the ancillary services. Now, that's going to impact... I really am afraid that if these cuts come down from the feds through the state to the city level, young people are going to see an epidemic like you and I walked through, like we all walked through in the early 80s. But it's going to be worse because they're cutting research funding also. And so you're going to see medically resistant strains of HIV and super strains of HIV, and they're cutting prevention funding, so people aren't even going to know how to prevent it. I mean, there's already that happening 40 years into the, epidemic, and there are people who don't understand how HIV is even transmitted, some of these coming out of medical facilities. It is really frightening. These cuts to Medicaid, I'll tell you right now, I'm on long-acting injectables. It's not cheap. The only way I can afford them is through my, ADAP, which is also being threatened. Our very own governor has, our state has borrowed almost $1 billion from the ADAP fund to balance the state budget. Those funds are supposed to be to provide medications for people who can't afford it, not to balance the state budget. And they'll pay it back when it's necessary, is their statement, the words they use. Well, it's necessary now, Governor Newsom. We need that money back because there are people who are suffering. I don't know what's going to happen in my situation. They've cut off my Medicare. I have ADAP. I just got Medi-Cal yesterday, emergency Medi-Cal. Who knows? There was a point where just a few years ago, I finally accepted the fact that, hey, maybe I won't die of AIDS. When I was diagnosed at age 25, we were convinced that my parents were going to bury me. Well, I'm 62 now. We just buried my mom last year. When they cut off from December 13 forward, they say I wasn't supposed to be getting this disability with an AIDS diagnosis. Like Vince said, HIV and AIDS. They don't look at an AIDS diagnosis. AIDS diagnoses don't go away. Yeah. But they're not looking at that anymore. They're looking at HIV stage 1, 2, and 3. HIV stage 3 is AIDS, but it's a chronically managed disease. So they're saying that I owe them everything from 2014 forward, or 13 forward. That's frightening. That's just frightening. When that happened, I thought, oh my God, I survived AIDS to die from AIDS? No, I will not accept that. I will not accept that. It's going to impact, like Miss Billie said, every time I get a letter, the anxiety, I have clients and peers freaking out that they're going to get this letter. There's been a few cases I've heard of where it's, years and years and years of people on disability and not just HIV. I heard of one person who has lupus, who's been on disability for a long time. They also got a letter like this. And the fear is these are test cases. Yeah. If the administrative law goes in the favor of Social Security, we could see an avalanche of these coming down for people who are on disability and working part-time, because disability, you can't make ends meet with just that, and the Social Security, it's like the government's like, be productive. These work requirements that they're talking about, there are people living with HIV like me who haven't been in the workforce for 30 years. They still use word perfect, You want them to go back to work? Right. Or the housing subsidies that they're going to limit to 2 years, and then what? Then what do we do? I mean, it is an attack on the poor. It's an attack on the most vulnerable populations in our society. And it was, Lance Thomas said it earlier, a budget is a moral document. Yep. It shows you what your government cares about the most vulnerable people. And this is what this administration is doing, and it is very frightening. And if you think it's bad in California where we have protections, imagine what it's like in the Deep South. The Supreme Court just gave South Carolina the authority to stop funding Planned Parenthood. It's the beginning of The Handmaid's Tale. It's totally what it is, and it's really scary.
Go ahead. Yeah.
So one of the things that I didn't envision in my life was being the caretaker for my parents. So my dad passed, but my mom's in a nursing facility in Alameda, and her health care, she wasn't there, would be $15,000 to $20,000 a month, and that's part-time, not full-time. So people don't think this is going to impact everyone, and I'm hoping that people will wake up, but that's what we're looking at, and that's why I think this is an issue, because the other thing that happens during this time is that money is short. They pit communities against each other, and it's really important that we try not to let that happen, because we will get through this together. I mean, one of the things that HIV did do back in the 90s and 80s and 90s was it kind of brought everybody together. We don't all agree now, but at one point we were working for the greater good of our communities, and I'm hoping we can get back to that.
And also, if I may, I would like to interject how we don't think about the people on the street living with HIV. We don't think about the people that are in nursing homes and rehabilitation centers who sit there and don't get, if they're not getting the proper physical therapy and speech therapy and what's the other therapy? Occupational therapy, are they focusing in on patients living with HIV. Because many patients are still like relatively healthy and they don't have no signs of HIV, but the HIV is festering in their body. And I think that it's going to get back to the stages where, because they say, oh, it's Miss Billie, there's only 1.2 million people. No, what about all the undiagnosed people that's walking around right outside this building, right across the street, walking on Embarcadero, in Atlanta, in LA, in Las Vegas? What about all the people that are living with HIV but don't know it? Some know it. And that's another thing, secrets kill. You know, when I was diagnosed with HIV, I knew that if somebody was going to get diagnosed, I knew it would be me because I was a tramp, honey. I was a tramp. And I was but I was a good tramp, thank you. And I was in my addiction. I was in my deep addiction. But I remember that I was choosing to live. And harm reduction wasn't really spoken about back then in the 80s and the 90s like it has been over the last 30 years. But, you know, I digress that, you know, as we sit up here and collectively together, we have over 120 years, or at least 100 years living with HIV. Because I go back when San Francisco General didn't have no Ward 86, Ward 5A and 5B. I go back when we were meeting in the lobby. We were going to clinic 1M3. We were seeing the doctors. My first doctor was Dr. Rose Perez. I don't know if y'all remember her. And, you know, and with the funding and with the money, I just hope they get this all together and we don't go back to the 80s when people start really getting sick and dying again.
If I may, you bring up a good point, Miss Billie. A lot of elders, when they go into long-term care, I'm directing this towards you, go back into the closet because just being gay. But with HIV being on top of that, that's going to drive that even further underground. And I think that's really going to impact this age group. I mean, we know that, or at least I heard that Laguna Honda lost the 10 HIV specific beds that they had because of the Medicare, you know, recertification process. So who's going to take care of, you know, many gay men came to San Francisco in the 70s because their families like aced them out. They were gay, get out. So they had no family. They came here in the 70s. They had this family of choice, and then AIDS took that family away. What happens when I'm 85 and I need someone to take care of me? Where am I going to go?
I'll take care of you, dog.
No, I know you will. With those big old shoulders.
I think you bring up a really good point because I remember thinking, when was this? This was probably like in February because, you know, in California, you know, I'm so glad to live here and that like at the federal level, you know, LGBTQ, like, you know, I think the whole community was being attacked on a national level. And then we were rolling out a new California required gender affirming care training that like all healthcare providers and facilities across the state needed to implement. And I was like, it was like, you know, I mean, it was hard, but I was like, thank goodness that we're in California and that they still have these things that they're like, we're moving forward, we're still doing it, you know, as long as we can.
But what about when the hammer is going to drop? Because I've been a part of UCSF transgender clinics and different focus groups and conferences. They cut that out. They cut out a big part of UCSF's funding for transgender studies and transgender services. And what about, I remember when there were no gender affirming surgeries. Mm-hmm. And probably if you're old enough in this room, you remember there was no surgeries. What about when the surgeries stop and so many people are going to have high anxiety and have issues about the surgeries? Mm-hmm. What about that, you know? So, I mean, I think Medicare and Medi-Cal should have had a bigger stance, a bigger part in the surgeries in the beginning. Mm-hmm. I think they really should have focused on giving people gender-affirming surgeries as needed or when they requested. And I also want to say why I got this platform, genocide. When the surgeries rolled out, there was nobody to talk to the trans women about harvesting their sperm to have children somewhere down the line. So that created a whole new area of genocide. That cut out a whole community, because we want to have children too. And if they take that away, there won't be people having children and stuff.
Yeah, we could probably keep coming up with points. So if you want to do Q&A with the audience, you should,
This conversation's so good. I'm just like, we can keep it going. Thank you to the panelists, and just for all of your knowledge, your lived experience, your experience. We want to turn it to the crowd for any questions you may have for the panel.
Okay, I'm really concerned with Open House because I have two friends there, and thank God they are there. That's supposed to be, for the gay community, and yet all the vacancies that are going now out to straight or non-gay. So I would like to see that addressed.
Well, I can start that. So this is where knowing policy is really important, and your funding streams, because depending on what funding you took to get something done, there are certain laws that apply to that. Like, I don't know exactly how they put together some of the pieces, but if they took federal funding, then you can't just designate, even though it says LGBTQI plus housing, you can't just say this is only for that, because that's discrimination. Also in San Francisco, we have policies that don't allow you to discriminate on people based on your gender or sexual identity, and Kathy Mulkey-Meyer from the Human Rights Commission is here. And so you have to know all these things. And so sometimes, because initially that was the vision, and I do think that for the ones that they're going to open the Castro, that will be specifically for LGBTQI plus. That's going to be I can't remember what the exact address is, but it's going to be in the Castro. But for the first sets of things that they did, they had to kind of go for kind of put it together, and people didn't realize, I guess, how that would impact the final product. But that's why probably because you can't discriminate against people.
I can also speak to that as a resident and board member of Marty's Place, which is the only self-governing cooperative low-income housing for people with HIV and AIDS in the United States. What you're addressing is fair housing laws. There are fair housing laws. Marty's Place does not take any city or federal funding, so we can stay focused on HIV and AIDS. If we take city, state, or federal funding, then we have to follow those guidelines. And there are anti-discrimination laws, which in the 70s and 80s, the queer community fought very hard for. So it would be kind of, what's the word, dichotomous? I don't know, to suspend those that we fought so hard for them. It's like HIV privacy laws. There are people who are like, let's let it be open, but we fought so hard to keep that stuff private. You open the door a little bit, and next thing you know, it's flung wide open. So it's definitely fair housing laws that are addressing the issue that you're talking about. Again, like Ben said, funding streams play a big role in that.
And I would like to say, as someone on this panel who is an active member of Club 75, and pretty much when I entered the facility and became a member, I've always been out with my HIV status, so I pretty much think I was one of not many people, seniors who are public with their HIV status, and I have had nothing but the best wraparound services and care, and I'm trying to get more of my trans sisters in, especially of color, into Open House and talk more about HIV, because like I said before, so many people have not yet been diagnosed with HIV, and that includes seniors too, LGBTQIA seniors. But Open House is fabulous, and some of the services they give us are simply marvelous, simply fabulous. So yes.
Did you have a follow-up? Did you want to say something else? Okay. Yeah.
Any other questions for the panel?
I almost hate to ask this question. But does anyone know specifically the status of future city funding, which probably comes from Medicaid, for Tom Omino's Healthy San Francisco program at SF General?
Do you know anything?
I don't know.
I have no specifics around that.
Well, probably UCSF has had cuts. They have been cutting funds. And UCSF and San Francisco Zuckerberg are in collaboration together. So I'm pretty much thinking that, I don't know specifically, but I'm pretty much thinking there has been some kind of funding cuts like that, yeah. Because I have a friend that's there, and this has been going on for decades. People who have had strokes and different stages of paralysis have not been receiving the best, like I said before, physical therapy and occupational therapy and speech therapy, and some people just wilter away. So funding has been cut for a long, long time, here and there in different positions throughout the hospital, and we all know that.
Yeah, and that's actually a good question, because I think we assume that it's safe. But I don't think, like, I know in our 50-plus program, the majority of people are under Healthy San Francisco. I was also under Healthy San Francisco at one point. And I think that's something we should check on to make sure that it's intact, because people don't think these kinds of things can happen in San Francisco, but we're kind of like, it could happen. And so I think it's good that you asked that question, because I'll go and check on that when I go back.
Yeah, I will too, because when they froze my Medicare, it was, thank God for Healthy San Francisco, that I was able to take care of some of the costs for my medical care. But without that, I really would have been up the creek. So, but yeah, we should research that.
I don't think
I didn't
that's
think
been
about
on
it.
our radar. We just assumed that it's actually a model thing. It's the closest thing to universal health care in the country. At one point, it was touted as that. So we've just always assumed it would keep going, but we should probably check on that to make sure.
It's a healthcare of last resort.
Right.
Right.
Yes, that's how I got on there.
Thank you for asking that question. That just put it right on our radar. I mean,
Yeah, I
we
think
need to
that,
know.
any program that's serving, basically nonprofits, city, state, like everyone is very vulnerable now. So even if their funding is currently safe, I'm sure they're concerned and they could use all support. So I really appreciate you bringing it up.
Yeah.
And then I hope it doesn't get to the point where share of cost, because when you're on Medicare, Medi-Cal, and you're living with HIV and you get your drugs through that entity, sometimes the share of cost is sky high. And the only way you can cover that share of cost is by getting HIV medicines and different specialty medicines. So if that is cut out, or if they cut people's money, already they don't give a. Who sat in the room and told them to give me this much for Social Security? Well, I'm on retirement now. They sent me a letter saying, Miss Billie Cooper, you are no longer on state disability. You are on retirement funds. Who sent them the memo to tell me how much I should get a month, when knowing that it's hard as heck to live on those funds? You bring up a good point also as far as these cuts, because at some point, many of us who are on Social Security disability will transfer over to regular Social Security. And in some cases, I know of at least 2 people who had to take part-time jobs after that happened, because their work history was a lot less than what they were getting as disability, and so they lose up to 75% sometimes of their income, and that can create a housing situation for people. So, my grandma used to say, golden years, you have full gold.
And we want you all to feel fired up when you leave this session, not depressed, because we know that this is it's kind of heavy. So please take all of it and think about what you can do, because it's important that we keep that hope and faith. And think about your future.
I was just...
my 2 fabulous panelists, well, all 3 panelists mentioned earlier when this part of the life, you remember that game Life where you move the things around the board? We have been living that for decades, the game of life. But it's really no game. It's really no game. It's like Vince and Paul said, it's lived in life experiences. Yeah. And I just want to say, people who are in disability or retirement, Social Security, they have to really worry about going in the workforce, back in the workforce, because that can screw you up. If your number comes up when they put all the numbers in the computer and your name and number comes up for you to be regulated and to be looked at, that could really hurt. That could really hurt. And if we live another 20 years, I'll be 80. I'll be 80. Oh, 86. Oh. I'm starting to feel like Joan Rivers, honey. 86. 20 years, all of us are going to be 20 years older.
When I started my job as long-term survivor community liaison at the AIDS Foundation, Vince asked me one question that nobody ever asked me before. Nobody ever asked us through these years of HIV and AIDS. And that was, what is the world you want to age into? And how do we go about making that world? And that totally reactivated the advocate in me and the activist. And so this is what, as Vince said, we want you fired up. This is how you think about the world you want to age into and how you're going to create that world. It's advocacy and activism.
I think we have 2 questions.
And let's be nicer to each other. It's okay to say good morning. It's okay to nod your head at somebody. It's...
Paul, earlier you were talking about the potential cuts to Part F, like the dental and ancillary services. What sort of things are people who are maybe HIV positive or people who are seniors currently benefiting from, where you're going to need to see community organizations picking up slack if these cuts happen?
Personal experience, a lot of long-term survivors starting with suffer from isolation. We have lost, not many people understand what it's like to lose your entire social circle of friends within less than 5 years, sometimes less than a year. So there's a lot of isolation, and a lot of the work that I do along with Vince is creating opportunities for people to interact, to reconnect with community. Social engagement programs are really things that community organizations are going to have to pick up. Studies have shown that people that stay socially engaged, they stay engaged in treatment. I remember it's at a conference, and there was this one gentleman from Idaho. He was the only HIV service organization within hundreds of miles in the middle of nowhere in Idaho. And he said, nobody comes to my support group. And I said, stop calling it a support group. I said, we have one every week. It's a coffee social. We don't call it a support group, but because people come to socialize, it evolved into this social support for folks. And he was like, I never thought of that. But those are the kind of programs, those art therapy programs, those ancillary that, the bean counters are they're not important, but they are so important to keep people engaged, to keep people connected, to keep people, working on substance use disorder treatment and other programs like that. These community organizations who I don't think people realize the impact and the importance of these types of programs.
Hello, everyone. So my question really stems about research. So I know that institutions are probably shifting or reevaluating how do we continue to look at research from a perspective of really pushing the needle, but being conscious of the social environment, right? And so one of those challenges can also be engagement in research. So if we talk about the populations that are often marginalized, we also can talk about, as researchers or, private investigators, how do we engage this population and the LGBTQIA in research, understanding the current crisis that we're facing and understanding the scarcity people might feel, right? So I think that in order to really push the needle and to identify how do we resolve challenges, barriers, come up with innovations around resolutions to challenges, it also takes engaging intentionally, but also acknowledging the fear that in all of the things that might present itself. So that's the first part. How do you engage? But then two, as institutions and people are coming into, what encouragement do you have for students or people who are trying to do research to still be motivated around doing research to push policy legislation because of their own challenges that they might feel having access to funding, having access to supportive circles that will allow them an opportunity to engage in research that will help marginalize communities that are intersects in many ways. So I think that's a two-part question.
I just want to say human kindness, because I cannot and will not believe that all these senators and representatives and Congress people don't have marginalized low-income relatives and people living with HIV in their families. And compassion, human kindness and compassion. None of us in this room started up any of these entities, but I guess Vince can speak more to it.
Right after this panel, literally, I'm going to go find a chair and I'm going to speak to the program is called Future Scholars, and they're with Gladstone. They are our future researchers. And so I'm going to go as a person with lived experience. Last week I spoke to them as a service provider. But also I've had a job. I was at Georgetown University. I had a title Director of Field Operations. And what that meant was I tried to figure out how to get our communities to participate in research. So one of the things that you can do as an academic is you can hire from the community. These messages sound so much better when they are coming from someone who looks like them, has some kind of shared lived experience. You also need to pay them. Like it's not a way for you to get your research done at a cheaper cost. It's like, no, you need to pay them at the same rate that you would pay someone similar. I mean, when I was working at Georgetown, I didn't have an advanced degree, and I kept getting promoted because every time something would happen, I would just deal with it. And at one point they said, we can't increase his salary again because it goes against all of our values. And my boss told me this, and he said, I wouldn't blame you if you just quit. I said, no. It's like, I need to stay and change this from within. And so the lived experience, looking at that, and you will find a lot. I'm also part of an NIH CAB we talk about how to do this. We come up with, it's based at Vanderbilt University. So there is guidance for how to do this. And if you don't know how to do it, and it's also, you need to do the work, because some people think, oh, this is a quick fix, we'll just do this. No, you need to do the work. You need to build relations. You also need to know, for our community folks, they also need to have high conversations, because so many of our people don't realize what a value their lived experience is. But you need to be able to convey that when you're in those initial meetings. And so it's gotten a lot better. And I know that for a lot of our long-term survivors, they want to be part of the cure, which is probably right now to standstill. But there's rules that you can't participate at a certain age. And so those are some of the things, because some of it is policy, but those are some things that you need to look at to kind of figure out how to change the system.
When you were asking your question, the first thing that popped into my mind was big pharmacy and the restrictions they put on some of their age limits for their research. And just to give you an idea, there is only one big farm that funds HIV and aging. One in the entire country. Well, two. One at a great level, one at a much smaller level. But that's it for any of this research, as far as the cure, as far as long-acting injectables or long-term medications. Two that actually take an interest in the communities that are aging with HIV. That needs to change. And then the other, another part, you could ask the community, how do we engage you? That's the way to do it. We, as you can see with this panel, we have no lack of our opinions and letting people know. And I believe, many of my colleagues, they'll tell you, nobody asks.
And also, most of the medicines are cousins. Most of the HIV medicines are pretty much connected in some kind of way. I know at least that's how it was in the 80s and 90s, because if you took a certain medicine, even today, I took medicines back in the 80s and 90s, and I can't be in some studies because of taking those medicines. And I don't know about the injectables. I don't want to go on that because that's probably more trauma and more edema and more, what's that word they say? We have so much in our body. What is that?
Tolerant? Resistance.
So, and what is it? Inflammation. We've been taking these medicines for over 30 years. How much inflammation enters our body, and does it all leave our body? And what about the toxins? What about these HIV medicines? The injectables, you have to fit a certain criteria to get on the injectables. They just don't put everybody on injectables.
Resistance, when it comes to your health, is not as good like resistance and advocacy, like what we're trying to do with this current, but this is a totally different kind of resistance.
I think we've hit time. I want to thank our panelists for all of the information. I want to thank all of you for joining us.
And if you're passionate about advocacy, I think Justice in Aging is a great place for people to go to. They're, having policy papers out. Helped me kind of figure out what's going on right now, and so that's a great place for people to go to advocate for changes that we know need to happen. Keep our funding.
Right.
On a local level, show them your T-shirt, Vince.
Oh, HIV advocacy. No, I was going to say. So when we ask people to show up, HIV Advocacy Network, we will actually create text messages for you. We will put you in touch with the politicians that you need to. But what we say is great. I hope it's great anyway, maybe not so all the time. But when they hear your stories, when they hear your lived experience, when a politician hears how it's going to impact your life, that's what they listen to. A few years ago, we had about 80 people at our Saturday morning coffees that Paul mentioned, text City Hall. We got $250,000 for mental health for long-term survivors because they do pay attention. So show up, and it's now more than ever, it's important that you call your politicians, your representatives, tell them where you stand on these issues.
Yeah, people think they can't, I'm not an activist, I'm not an advocate. It's a text message. It's an email that's created for you. You just sign your name to it. It goes out to all of them. That's all it takes. That's all it takes to be an activist or an advocate. One email, one phone call, one text message. It's not a lot.
And we need more people like us in those roles of senator, representative, congressperson, because it's time for the old guard to be voted out. And people of color, we need more people of color in Washington, D.C. We went there earlier this year for AIDS Watch 2025, and still you don't see a whole lot of black and brown people. You see a little more than you did probably 6 months before, maybe one or two, but the numbers still haven't caught up with each other because all those people, the Supreme Court, the Supreme Court, I don't know if they really sit down and read their briefs about HIV and AIDS and about seniors and about all the comorbidities that we as seniors go through. When I turn 70, wait till I turn 75, honey, I'm going to really let them have it then.
And we'll end on that note.
And Mr. Lee, when you turn 70, we'll have a big old party.
Yes, a big old
Billie for president.
Yeah. Why not? Yeah.
You're like,